the side effects of, the collateral damage, I think is what he calls it. When people aren't out and doing stuff, they get more obesity, their diabetes get worse, and we know that those things make their COVID infection worse as well.
Yeah.
So we're not really helping ourselves by not doing anything.
Mm-hmm.
There has to be a happy medium where we can still be safe, but at the same time still do some things that will not only keep us healthy physically, but also mentally, and help us withstand more of this if we need to.
Yeah.
Hello, Clear Lake Area Chamber of Commerce members and Bay Area Houston. If you're a business wanting to expand your customer base, give back to your community, think about the quality of life around Clear Lake area, think about joining the chamber. Go to clearlakearea.com for more information.
Hey, welcome to another episode of Clear Lake Connections, where we talk to the people behind the businesses of Bay Area Houston, proudly sponsored by UTMB Health. Today I have with me Dr. William Weiss, and you are with UTMB.
Correct.
The sports medicine orthopedic section.
Yes, exactly. I'm an orthopedic surgeon by trade, but I did 2 fellowships in sports medicine and then 1 in foot and ankle before working in El Paso before coming back here again.
And kind of what's your specialty? Is it younger athletes or across the board?
I will take care of people across the board. My preference is the younger athletes, probably from 12 to 30, 40. I can do things outside of that range, and I will, but that would be my preference, is to narrow it between that age group.
They heal faster.
They do. They make me look better.
More responsive. Yeah. But because we were talking about this before, that I have some issues that probably need to be addressed by
Many of us do.
orthopedics. So, but what's the most common injury you're seeing I guess in different age groups?
Yeah, I mean, in the younger athletes below the age of 20, particularly the female soccer player variety, is typically an ACL tear, meniscus tear. We see it a lot in the men as well, and the young football players. As patients get older into their 20s and 30s, then things like arthritis start to creep in a little more, which is usually pretty mild at that stage. And then in the over 40 crowd, there's definitely more of the arthritis, which is harder and harder to deal with. And then there's always trauma. I take trauma call at our level 1 and whatever Clear Lake is as well, trauma center. So we see a lot of trauma there, but also on the field, not uncommon that we'll have a fracture, a tibia, a forearm, something like that.
Yeah, and I think my daughter, she broke her arm one time, and she went to the ER, and the immediate thing was to refer to an orthopedic, because at that age they can still kind of you can still help them normalize the break.
Yeah. Well, even in the ER they can, and this is not true of every ER. There are some ERs that don't do this, but there is a role for the ER provider to do a reduction at that point, which sometimes is adequate, and all that's needed to be done. And kids, while they're still growing, have the potential to remodel their bones, and so as long as it's within an acceptable limit, then we may just leave it and let nature heal itself, as it were, and that works very well. It's really in the older population that stop growing where things need to be put back to normal, and that's kind of where we come in a more concerted degree, I suppose.
Yeah, and I've noticed that. So my other daughter, this is going to sound bad, but she broke her finger and ended up having orthopedic work done on it, so that it healed, and you can't even tell. And judging by my hands, we didn't have that when I was a kid. So talk about some of the more recent developments in your field that you think are important for people to know
orthopedics has come a long way. I mean, it used to be a very small specialty, and I make the joke to the residents all the time that, our Bible, if you will, is called Campbell's Operative Orthopedic Surgery, and it used to be just 2 books, and that was probably in the late 70s. And now it's like 5 or 6 huge volumes, and so the number of things that we're doing is grown, and one of those areas is sports medicine. And part of that is technology driven, because now we have these little cameras, we have fiber optics, we have little anchor implants that we can put into bone, reattach tendons that become bone again. There's a lot that technology has opened up that we could not fix in the past, that now we can fix, and we're saying, well, hey, maybe we should fix that, and usually we're right, but sometimes the answer is not to fix everything, and that's an important thing that we try to teach the residents, and I still learn as well day to day.
Yeah, my wife told me the other day that my nephew, pretty good baseball player up in the Chicago area, he can't be, but in junior high, has already had Tommy John surgery, and so obviously that's an advance that was reserved for major league pitchers, and it took them a year or 2 to come back, and now they're doing it, and the recovery time has just decreased so dramatically.
Yeah, you're speaking to 2 things there. One of them is an important pediatric sports medicine point, and that is that we're seeing the need for Tommy John surgery in a lot of our young baseball players, which never happened before. And that goes back to something that has happened recently, where they've moved to pitch counts and preventative measures to prevent that from happening, but it still happens. And when it does, yes, this is now available. It has become a little more technologically simple with the advent of these new implants like I was talking about, so that most sports medicine surgeons can do something like that and do a good job of it. And so we're doing more and more of it in the younger athletes who need it, but hopefully not seeing as much of it as we were at a time.
And you said something before when we were talking about how surgery is kind of the last hurrah. You don't want to do it if you can avoid it. Talk to me about what these parents can be doing for their kids to help prevent some of these possibly down the road issues.
Yeah, that's a great question, and it is true that no knee that I can give anyone is as good as their knee was before they injured themselves, unless they have a bad injury that I can therefore make better. So a lot of times for an elective thing, it is the last resort. Now, looking at ACL tears is a great example of both of these things. If you have a full ACL tear, your knee isn't going to work normally, and there's a very small group of the population that can compensate for it with muscles. And if they can do that, great, they can continue. But most people can't, and they continue to have buckling episodes, and that causes further damage and leads to arthritis sooner than it should. And so in those patients, that's when we get into surgery, of course. But there is a preventative program that's relatively new. There's a number of them floating around the U.S. and Europe where we're teaching younger athletes to land properly, to protect their knee in space when they're playing. And it's shown great outcomes in terms of preventing ACL injuries, and particularly young active females, which is really the number one group that we see that in. So there is prevention out there. I think just most either schools or programs aren't involved in it, but it's not difficult. It's something that in Europe they just added to their warm-up, and it had great results. So that's something that here we're pushing, and we'll hopefully push more as we get more involvement with sports teams around the area.
So that's the second time you've talked about, kind of the people you're seeing, and it seems to be the younger ladies. Why is that?
We don't know, to be honest. It's a multifactorial thing, as we like to say many times, but it has many contributions. One of them is thought to be just anatomy. Females have slightly different anatomy than males, and that may set them up for this. It may have to do with ligaments and the relation with hormones, and there's some evidence that shows that birth control may affect some of this, or hormonal cycle may affect this. So we don't know. There's no one answer to this yet. We do know that the numbers are almost 3-to-1, though. In probably less than 18-year-old ACLs that you see, it's 3-to-1 females to males.
Oh, wow.
It may have something to do with the training as well. Maybe they're not getting the preventative measures. It may have to do with muscles and the way that the females carry themselves compared to the males.
And you said it was mostly soccer. Are there other sports?
Mostly soccer, but the big three are really, for, I guess, football, which is predominantly males, but females. Soccer, which is both. And soccer is probably the biggest female contingent. Basketball, is a big one on both sides as well. And then we do see some in volleyball from landing, from jumps.
Okay. Any specialty kind of sports that you see quite a bit of in this area, like tennis or things like that?
I wouldn't say anything really, not for me yet. I mean, I've only been here since November. But the majority, this is Texas, so a lot of it is football and football training. Soccer is obviously big, not just with the ladies, but with the men as well. And there is a fair bit of tennis. I don't see too many injuries from tennis. I've seen a few baseball, weightlifting. It kind of runs the gamut, I think, at this point, with everybody just getting back into sports and doing what they want to do.
And so did you just move down here in November?
Yeah, I got here, late October and started work November 1st,
so
I believe.
You've come for our hot season?
Yeah.
How are you enjoying that?
Yeah. It's okay. I lived here before. Okay. I was here as a fellow, and so I'm pretty used to it. Not that El Paso is that much cooler, but definitely doesn't have the humidity that is out here.
But you have an interesting background when it comes to your education and the way you started, and it gives you kind of a unique perspective on what you're doing now. Let us know about that.
It does. I'm Canadian, and I grew up there and did my medical training there, my master's degree, medical school, residency, and then I did my first sports medicine fellowship there, which is a little different than things in the U.S., but very similar. And then I came to Dallas, actually, and did my second sports medicine fellowship. And then because of the social situation in Canada, was unable to find a job in Canada. So was lucky enough to find a fellowship here at UTMB that I came to do with Dr. Panchbavi in foot and ankle. And so I did that, and then I was still unable to find the job I wanted in Canada. And so I took a job in El Paso working with the Texas Tech group there that has a residency program that's largely U.S. military. And so I did that for almost 5 years, and then was able to, to get all my visa stuff done, and as a Canadian got a green card, and then was able to go where I wanted to, and basically called up Dr. Lindsay and said, hey, we can do this now. And he said, okay, come on down. And so that's what we did.
It sounds like we originally emigrated over from Europe, and Scotland in particular. My dad was Scottish, and he always used to say, and I think this rings true for Canada as well, our number one export is people. Yeah. And people here take for granted how much not just, we use the word freedom, but opportunity to find jobs and do what they want.
Yep.
And
that was the big thing, honestly. And I did have interviews in Canada, a bunch of them, and they were all, potentially good jobs, but they all had something like, I have to live in the middle of nowhere, which as a triple fellowship trained surgeon, I'd like to do my fellowship. I don't want to do general ortho, so that wasn't good. There was another job that said, well, you can come, but you have to do knees. And I said, I like knees, but I also like shoulders and hips and foot and ankle. Like, no, you can't do that. I also had another job that was a part-time job, and they said, well, listen, doc, you're not going to be able to afford a house here on your part-time job. And I said, oh, okay. I mean, that's not great
problematic,
either.
yeah.
So I mean, I had liked my experience in the States, and I tell people all the time, it's not that different. I mean, I don't think I'm in a different country half the time. The people are the same. So it was a natural transition to just, well, I'll just stay here.
Yeah, and on this program, we like to talk about Pie in the Bay Area and the Bay Area region, and you guys are a big part of that. And the medical community here has been growing, and the opportunities are here. Like I always tell people, I don't like to go into Houston. I think I have everything I need right here.
Yeah.
And you guys are a prime example of that. With the population we have, the opportunities for you guys must be kind of limitless, especially with all the sports programs.
Yeah, I mean, that's one of the things that we're trying to currently take advantage of, if you will, is that we have a presence here, and there's lots of sports happening here. And now there's myself, there's Dr. Smith, who's been here for many years. There's Dr. Lindemann, who is a recent resident graduate of here, who's come back as well to work here. And we have a primary care doctor, Dr. Bardwaj, who works with our group as an orthopedic department as well. And so the four of us have decided that, okay, we have the numbers now, let's go out and get ourselves on the field and get some more athletes into our clinics. And so that's the push that we're making with our program, is trying to put us on the sidelines so that we can bring more patients into our clinics and do the things that we want to do, which is take care of athletes.
And how does that work typically? I mean, how does
it works
how do
in
you
many
grow
ways.
a program
Yeah,
like that?
there's many ways to do it. The approach we're taking is really just to be present and be the one that's there on the sideline, so that when little Jimmy hurts his elbow, he sees Dr. Weiss, and mom and dad say, we like that guy, let's go see him next week. He seemed like he was nice, knew what he was doing. What's his contact information? And the trainers, have a relationship with us, and they would say, yeah, I mean, I'll call him, tell him you want an appointment. So we're just trying to put ourselves in the position to be there for the athletes, and hopefully, bring them to us because they like us and think we do a good job and care. And that's the point.
And where are you located?
I currently work at all three of our campuses, which includes the island, Galveston Island, Clear Lake. I take call here, although we don't have an orthopedic clinic here. I do have a clinic at League City as well, and I do surgeries there as well. So we cover all up and down between the two, I guess, Clear Lake and Galveston Island, and who knows, we may continue to grow. We'd like to continue to grow.
Yeah, and I talked about UTMB's growth. When I drive out of my neighborhood a certain way, I look up and I see the big UTMB building, and it's amazing to me. Literally, to me, it seems like it sprang out of nothing.
Yeah.
And now, you're talking about orthopedics. We've had some other, very specialty kind of programs on there. And again, I come back to this Buy in the Bay Area idea that you don't have to go to the medical center. We've got our own medical center right here.
We do that. That didn't exist when I was here as a fellow either. I mean, it was whatever it was, and I left in 2016. I left, and I came back, and oh, by the way, Dr. Weiss, there's this hospital here you can take call at. And I'm like, oh, okay, that's cool. And it's been a great experience taking call here. It's not as busy as the island, but some weekends you wonder.
So the island is busier. What
typically,
are you seeing
because
there?
that's our level 1 trauma center. So
Okay.
anything that's big that's coming to one of our facilities will typically go there.
Okay.
It has all the benefits of a long-standing major hospital. Clear Lake for us is not a level 1. I'm not sure what its ranking is, but it does take trauma call. It does have trauma surgeons, and it has orthopedic surgeons on call to help them with it. So we can handle most things there, but anything really big that would come to UTMB would still probably go to the island.
And then a part of your background, part of your education was in immunology, if I'm not mistaken.
Yeah, I kind of took a long road to get to medical school, and I did undergraduate and master's degree in biochemistry, microbiology, and immunology before going to medical school. And I also took a degree in exercise science in there somewhere.
And
So I have a
so
weird
a part of
background.
kind of your background has lent itself well to what's going on right now with COVID.
Yep.
And so what advice do you have for student athletes and maybe adult athletes when it comes to COVID and still performing at a high level?
Yeah, this is a big question going on right now because I know people are back in school here. In Canada, they're returning to school now for probably the first time since they've let out. So there's a lot of talk about safety, and that's really the bottom line, is being safe and being smart. And there's nothing that anyone can do to completely remove everyone's risk. We've seen that with the vaccines. They work, but there's still a chance you could get an infection. It will be better if you have the vaccine, according to the data. But there's still a chance you can get it. So moving forward, looking at sports in school, the key is still safety. There's never been good evidence that there's a lot of spread in the schools, so that is a low level of concern for most people, and it's similar to the community. So if you have a low level in the community, you'll have a low level in the schools. Everybody is pretty safe. Sports brings another aspect of it, and that is contact. In contact sports and closeness and, running around, breathing heavy. And there have been limited studies about that, but there is one from Europe that showed in rugby players, so these guys are making contact with each other, tackling each other, that the spread, they did a study of 4 games. They found that there were, I think, eight guys that showed up after the game that they tested positive. So they weren't displaying symptoms, but they were symptomatic likely during the game. And it spread to only one player, they think, in that whole series of 4 games. In the ongoings of their regular, team life at the gym, at the training center, interacting with administration and staff, there were actually a lot more infections. And so out of all the infections they identified, which was 8, I believe, only one of them was potentially due to on-field. And even that one, they had linked to a contact. So the actual contact in the game is not spreading the virus, we don't think, based on these few studies. So the main concern continues to be what the teams are doing outside of the games, which is, congregating, taking buses, going to team meetings. So I think safety measures are still important there, and masks and spacing and whatnot. But the game itself doesn't seem to be dangerous, and I guess that will remain to be seen as well with our upcoming seasons. But right now, it looks like it's a low risk.
Yeah, and I know they played high school football last year,
they
and
did.
so I think maybe that also speaks to what you're saying.
I think so. Yeah, we certainly didn't see teams, coming down with COVID all of a sudden, or 2 teams mixing it, and both of them coming down with COVID, for example.
But I think it's also important for people to realize how important sports are.
Yeah.
To people, and
Exactly.
obviously you've gotten into this field for that reason,
Yeah.
because a passion for both.
Yeah, this has been a tough year and a half for everybody,
Yeah.
and this returns us to a sense of normalcy. Even just, I know every weekend, every Sunday I sit there and I think, wow, it'd be nice if it was, if we had NFL football, for example. So people miss it when it's not around, and I think that having some of those things back safely will help everybody return to normal. And not only that, one of the problems we're seeing is that people are getting fed up with all these restrictions and not being able to do what they want, and that's understandable. Maybe something like the return of sports can help kind of mitigate that and keep everybody on their toes for a while longer, because we're getting to critical points here where things are potentially getting bad again and getting worse than they were already. So now is not the time to sit back and watch.
Yeah, and I know when we went back to playing soccer again, just there's a it's not just about doing what you want, but it's a release, and it's good for you. I mean, playing sports is
definitely
good for you.
The other side of this, that a good friend of mine from Canada has a podcast that I was on recently that I've of course listened to him a lot now. He makes is that it really, the side effects of the collateral damage, I think is what he calls it. When people aren't out and doing stuff, they get more obesity, their diabetes get worse, and we know that those things make their COVID infection worse as well.
Yeah.
So we're not really helping ourselves by not doing anything.
Mm-hmm.
There has to be a happy medium where we can still be safe, but at the same time still do some things that will not only keep us healthy physically, but also mentally, and help us withstand more of this if we need to.
Yeah. So, any last words for the audience? Anything you want to tell them about the practice?
I don't know.
Now would be the time. No?
I'm always around, and I was late today because we were in clinic, and
Well, good.
It happens. But no, all of our group is very approachable and reachable, and we aim to get our athletes in same day or next day if needed. We're always around and willing to help, and I hope that you will see more of us on the sidelines this coming season, and going forward even more of us as we try to grow the program. Not only ourselves as an orthopedic group, but our PT/OT department is involved. We have a strength and conditioning coach that's involved. We have primary care medicine, pediatrics that are involved. So we have somebody for everything. We even have a sports psychologist. We have people that can help whatever the issue is, and we're close. We're right here.
and you're accepting new patients.
Always.
So.
Always. Never say
And you
no.
prefer younger because they heal better, but I'm gonna come see you and maybe give you
fine.
a challenge.
I will never turn anyone away because of their age or
good.
anything else. My oldest patient, I'll tell you, is, I believe she is 97.
Oh wow.
And my youngest is two days old in the last little while. There was a
Oh,
day
wow.
that we saw somebody in their first month of life and somebody in their late 90s, and my resident thought, this is a really weird sports clinic.
What sport are they playing?
Yeah.
So anyway, pleasure to meet you. Thank you so much.
Thank you.
And look forward to seeing you.
Absolutely.